Yeah. Good morning, everybody. I thank Nikhil Pansy for request me to talk on the subject mentoring in plastic surgery. It would have been wonderful to be all with you, but then circumstances, I think, allow me to only to do a Zoom meeting. In fact, it's a great topic because I think the future of plastic surgery is made by mentoring. If you like to know as to the origin of the word mentor, I think if you just go into Google, it will tell you that it starts with the king Odysseus who was fighting the Trojan War. And then he wanted his son to become better. So he appointed mentor, who was his friend, to groom his son, Telemachus, into a future king and warrior. So what we are trying to do is we are trying to do our younger people. We want to try to mentor our younger people to become the future leaders in plastic surgery in our country. But the question is, while it was okay in the context of the Greek mythology and the previous so many 100 years ago, is mentoring still relevant? I think that's the question. Or are mentors necessary in the presence of social media? If we are bombarded with content from ChatGPT and AI, I think that's the question that we have to answer first. I personally think is very important because if you have to succeed in life, I think you require hard skills and soft skills. And previously, for both of them, you needed a mentor. But then in the digital era, I think enough guidance may be available to obtain all the hard skills that are required for practice surgery. You have any number of YouTube videos to tell you how to operate, how to perform a surgical procedure, and that's what is a hard skill. But then to get the patient to the table, I think you require a lot of soft skills and much more than that. And these are the importance of soft skills. I think what they could teach you. It is just not for profession. I think it goes beyond profession because we need to maintain our relationships. I find that in course of time, people struggle with the relationships, not only with their colleagues but also with members of the family. And when you're in the 40s and 50s, you would have been in a good team and then you would have nurtured it for long. But then suddenly you may feel out of place. I think if that's happened, if that shouldn't happen, that means you need a mentor. When your confidence at a low ebb, but you need a mentor, and you really need to communicate well, communicate with everybody so well, so that the life is very pleasant. So, mentor is invaluable to provide the finer ingredients of success. And yeah, I like to tell you that as difficult it is to get a good mentor, I personally feel it is also as difficult to get a good mentee. I think that's some time back, I was writing an editorial in Journal of Hand Surgery. In that, as part of it, I quoted two quotes which are very relevant. It says, "Yeah, a teacher will appear when the student is ready." That was no so many thousands of years ago. Gautam Buddha said, and quite later, Lao Tzu, the Chinese philosopher, also said, "When the student is truly ready, the teacher disappears." I think both of them are very true. And the first part of this talk will contain a little bit about mentors, and later on, I'll go on to the mentee. Mentors must be mentors. I think these days it is extremely difficult to be a mentor. Even about 3 or 4 decades ago, when there was not much access to information, being a teacher or a mentor was easy. You had decades of experience, you operated on so many subjects, just because of your experience and age, you had got enough to hold the interest of the students. But now the mentors are evaluated on a global level. So the mentors, the teachers, must be very well prepared enough to get the respect of the younger colleagues. That's the first one. The second one is that the mentors also need to walk the talk. And there is a great saying which says, the children may not do what you say, but they keep seeing what you do. Similarly, our mentees may not do what we say, but they keep seeing what we do. I think this amounts to from big things to small things, from things like commitment to patient care, whether you come up, when they say that the flap is failing, from small things like that to bigger levels like integrity. I think that is very important. And it could be very quite demanding, may I tell you, because taking a personal examples of our system, we get about 150 visitors a year. And you are never alone. I think as the time you operate, you are surrounded with a lot of people. And particularly if you have to mentor bright people, that means you have to be on top all the time. It is be extremely could be demanding, but then it's good because it helps you to scale higher. And just because you are never alone, you will never do a mistake. Because if you are with a lot of trainees, I think they are all around you in outpatient. They listen to you as you interact with the patients, see you how carefully you examine or how you take care of them, how do you listen to them, listen to how much you quote as the cost of surgery, see your response when the patients say that they cannot be able to afford. So there are ever so many things. But then if you also have your vision and mission statements which are there everywhere, and you say that you want to be a center which is the pride of the country, or you say that you'll do things at affordable cost so that your expertise will be available to every citizen of our country. That means it's extremely difficult to walk the talk. And when you walk the talk, I think when you commit yourself to doing that and you become a good mentor, then what really happens is the person who benefits most is the mentor. It'll all become simple if you understand as to why we exist. If we keep that as the main thing, I think everything will be fine and mentoring will be easy. And as the Mayo Clinic founder said, the interest of the patient is the only interest to be considered. So if you really agree to the core value all the time, that means you should be it is easy to become a mentor. So for a mentor, at the end of the day, I think what will stand is what your mentees think of you. I think I'm absolutely convinced about this. And it's also important because for the success of institutions and survival of institutions, this is important. I think there must be good mentors and good mentees because rarely institutions are able to maintain their glory beyond two generations. And in a surgical field, the generation is of about 10 years, 10 or 15 years, 15 years at the most. I think usually it's 10 years. The units are able to maintain their peak performance and standing for just for 10 years. So what we really need is to continuously, we need to churn out mentors. I think churning out good mentors is absolutely important if we have to keep our units survive and keep their glory. The mentees whom we mentor, I think they must become better than us. I think that must be our goal. I think if you are able to succeed that, I think that is good for the country, it's good for the unit, it's good for the specialty. Encouraging that and making it happen is the responsibility of the mentor. I really had this example when we are editing this book, Crafting the Legacy, during the last Asia Pacific Hand Surgery meeting. And we got all the men, all the pioneers in hand surgery of the IFSS in the Asia Pacific region. And we thought we'd get one of their mentees to write it. And some of the patients, some of the candidates, I think we found it difficult to get a good mentee. So that means unless you have a good mentee, I think what your work also will get forgotten. I think the mentors must remember that. So in summary, I think a mentor needs to evoke a lot of respect. The mentor is going to be continuously evaluated, compared, and assessed. In addition to hard skills, must be good in practicing soft skills. And in fact, in short, and if I had to say, I think you need to walk the talk as to whatever you are, what you aim to be. Now I come to the mentees. I think this half is a more important part of the talk. I'm sure. I hope there are a lot of young people listening to that because the future of plastic surgery depends upon this. There's a frequent lament amongst the younger people. There's a lack of available mentors. So I like to say what I told in the beginning of the talk. A teacher arrives when the student is ready. I personally feel most often the student is not ready to realize the presence of the mentor around. I think the mentor maybe just be around. I think it's on the mindset which makes you understand and realize that you have got a mentor around. I'll tell you about 4 points I want to talk. The first point is that I request our younger people to have belief in the value systems. This is an ad of the DHL, which was published in Times of India on all newspapers at the end of the COVID. And it said, everything and nothing has changed. It has been a tough year for most. The world is feeling a little more uncertain. So it's reassuring to know, I think this line is the most important. So it is reassuring to know the things that were truly important yesterday still really matter today, maybe even more so, like the power of the human connection. I think that sums it up everything. I think it is just after COVID. But what I would say is that if these words that we typed out about another 200 years later, or if I say that was given about 500 years before, I think still it will be relevant because these things do not change. So, what mentors could teach, as I told you, is that a lot of soft skills is very important. What I would request to our young people is that you need to respect the teacher. I think unless you respect a person, I think what or he or she says will become irrelevant. If you want that to be relevant, if you have to gain from that, that means you need to respect them. It even applies to your own parents. Unless you respect your parents, you may not benefit from their wisdom or their experience. What is really important is that to feel that you could be modern in your thoughts but be traditional in your values, and you don't have to feel shy about it. See, sometime back when I went to Japan, and then if you have to enter the room of the chairman, you have to take off your shoes. But then if you come from America or India, I think it's something new. But then before that, somebody is outside the hall will say you, who is escorting you, will say, please take off your shoes. If you just give a surprise look, they'll just bend down and say it's Japanese custom. So that means, I don't think, there could be any society which could be modern, which achieved well, I think economically sound in Japan. But then they don't feel shy about it. I think that's the greatness of that. It amounts from dress code to patient interactions. For the young, when someone older tells you that it is good, I request you to consider that they are telling it to you for greater good. See, this is an example now, just about a few days ago. I was just on my rounds and I saw some new persons walking in front. And I found that there are paramedical trainees from another college who had come for internship to our institution. I saw him on the rounds. I said, that's not the way, you come to a hospital. I think I called him up and then admonished over him and two of other students. I said, why it is important that you cannot be at Ganga Hospital in this way. But then, I was so surprised. Again, next day morning, all those students came back, and that's the change. You really can't realize this is the same candidate. But then I was extremely happy that he complied. I greatly appreciate him for complying. I told him that years later that you remember this incident as one of his most defining moments of his life. From then on, what I felt was, no, I should do something for this guy. I felt that I could invest my time on him. I think that's the most important thing that he gained by changing his hairstyle. But then, how did I get this courage to do it? Because you get it because now you get mentored. I think nowadays you could get mentored even by reading books. I think one of the things, what really made this was this book, Management Lessons from Mayo Clinic, which I would have read about more than 10 to 15 times. There's a chapter on orchestrating the clues of quality, which almost mirrors what happened, the incident that I told. I don't know how you are able to read it, but then I would say that chapter on orchestrating the clues of quality starts off with these words. The lady with the dirty shoelaces. Marianne Morris, who manages general services and Mayo Clinic volunteer programs at the Mayo Rochester, likes to tell a story about her early days at the clinic. She was working in a laboratory, a job that required her to wear a white uniform and white shoes. And after a frantic morning getting her two small children to school, she arrived at work to find her supervisor staring at her shoes. The supervisor had noticed that the laces were dirty where they threaded through the eyelets of the shoes and asked Morris to clean them. Offended, Morris said that she worked in a laboratory, not with patients. Why should it matter? Her supervisor replied that Morris had contact with patients in ways she didn't recognize. Going out on the street wearing her Mayo name tag, for instance, or passing patients and their families as she walked through their halls. And that she couldn't be represent Mayo Clinic with dirty shoelaces. Years later, she recounts that though I was initially offended, I realized over time everything I do, down to my shoelaces, represents my commitment to our patients and visitors. I still use the dirty shoelaces story to set the standard for the service level I aspire to for myself and my co-workers. But then if you are convinced about it, I think it's not difficult to do this. But then my humble request for younger people is that when someone older tells you, I think whom you respect tells you, please listen. I think that. So when I tell my colleagues to read the book, I think it's an advice. When they see me do this in the rounds, I think when I attempt to change the intern, they see mentoring at work. That well explains the relationship of mentor and mentee. The mentor must show the courage of his convictions many a time, and particularly in demanding situations. Second thing for the mentee is that it's important to be humble. I think this is a quality that I find to be on the decrease amongst the mentees. Mild arrogance comes from the perceived quantum of knowledge they possess, but I personally feel the loser is the mentee. With the explosion of knowledge, most trainees are on a level platform. But I think what would make a difference in success is the soft skills they acquire from a good mentor. Point number three is that you must respect the mentor. I was fortunate to have great mentors. I think mentors are no mentor is perfect. I think I got a lot of things. I'm not perfect, so I should always remember life is a package. Like that, mentors also come up with their inadequacies, bias, and shortcomings. But if you concentrate on their bias and their shortcomings, the chances are that you will miss out on gaining the good qualities and capabilities of the mentor. Yeah, an incident happened when I was in ASSH meeting in San Francisco. One of the Indian colleagues who came with me was photographing a person who was a homeless beggar who was there. It was so surprising for me because you didn't come all this way here just to take this photograph. I think you really came up now to do see the kid, and you really need to think, how did they build this bridge, years ago without a computer? It's a question of perspectives. I think that's very important. The last is that now for a mentor and mentee relationship, I think who is a mentor? A mentor is someone higher in the hierarchy who can help you to rise. And how will the mentor help you to rise? You must work in such a way that the mentor feels that he has got to lose by not helping you. I think that's very important. I think you need to really listen to this word once more. But how will that happen? You just have to do what is needed in all situations and not what you like to do or is comfortable for you to do. And if you are consistent in doing that, I think no power on earth can stop you from becoming a great surgeon who can leave behind a legacy. Thank you so much.